So you're probably wondering what actually happens when a man comes in to talk about dysfunction. First off, we slow things down. Most men come in with a lot of urgency, and understandably so. There's often anxiety, embarrassment, even hopelessness. So we start by naming the truth, that this is something many men go through, and that it's treatable. From there, we do a thorough sexual and relational history. We're not psychoanalyzing, we're looking for patterns. When did this start? When does it happen? Are there times that it doesn't happen? What messages did you grow up with about what happens when you feel pressure to perform? The assessment can take several sessions, and I prefer to look at it as a living, breathing, evolving part of the process. New information may continue to emerge that helps to sharpen the focus of the therapy process. Over the course of these sessions, a direction for intervention starts to emerge. This can include cognitive, behavioral, mindfulness, or relational assignments. These interventions are tailored to your specific situation and are tested in between sessions and are refined. Most men are able to see forward progress, allowing for a positive cascade and leading to a satisfactory resolution. A big part of this process is understanding how anxiety hijacks arousal. We're working with the nervous system here. If your body thinks it's under threat, even if the threat is just, what if I can't perform? You're going to get a stress response and not an arousing one. We talk about ways to interrupt that cycle: breath work, grounding, body awareness. We might use structured exercises like sensate focus to rebuild your connection to sensation without performance pressure and expectations. And if you're in a relationship, we sometimes may ask you to bring your partner into the process. We use EFT, which is emotionally focused therapy, to help you rebuild safety and connection, not just but emotionally, because intimacy and vulnerability are at the core of this work. If you're single, you focus on how you relate to yourself, your sense of identity, your expectations, your ability to tolerate uncertainty and to stay present, to trust your body again. There is no one-size-fits-all when it comes to therapy, but the goal is always the same: less pressure, more understanding, and a renewed sense of confidence. So now you're probably wondering, how many sessions of therapy are needed to work through dysfunction issues? Therapy is a highly individualized process, and the number of sessions generally depends on age, how long the problem has been occurring, and what the desired outcomes are. I tell most guys that I work with that we are looking for some indication of responsiveness within 4 to 6 sessions. Some men I work with are satisfied with their outcomes within that time frame alone. Other men need more time to be able to get towards their goals. Some men choose to continue sessions as a way of maintaining their forward momentum. Is this work done individually or with a partner? Over the years of doing this work, my colleagues and I have developed our approach, which is a focus on individual therapy for function issues. At times, we may ask a partner to join for a session or two as needed. What if there are physical problems? Is it still worth going to this kind of therapy? This is a very complex question. So firstly, it depends on the nature of the physical issues and what the goals of the therapy are. Many physical conditions are a contributing factor, but are not the sole cause of dysfunction. This is commonly seen in men who have health issues, but can still achieve an on their own at times, or are getting morning. In these instances, therapy can help to genuinely move the needle towards more consistent and satisfying experiences. Almost everyone can benefit from sex therapy, even men who are experiencing a purely physical ED. It is psychologically distressing and can lead to deeper issues that can linger even if a physical solution is in place.